irritable bowel syndrome, that is a kind of catchphrase. One of the challenges with difficult to assess digestive disorders is that that's actually just what it is. On the allopathic medicine side, we've put a label to that called irritable bowel syndrome. When you get that diagnosis, we have to really dig in a little bit more into what does that actually mean for you as an individual. You could have irritable bowel syndrome where you are tending towards constipation, or you're tending towards diarrhea, or you're tending towards an alternation between those two things. They're not going to get the same treatment approach from a holistic point of view, but they may get the same medication from a Western point of view. So maybe not the same medication for somebody that has diarrhea or constipation, but if you have an inflammatory digestive disorder, you may get the same medication, but you may be able to come to a holistic practice and have one of 10 different options for how we may approach that. So you as an individual are really important for us to see and for us to work with to determine what the right approach is going to be. From a holistic point of view, we're going to talk to you about your diet. What are the things that are exacerbating this condition? Do you know there's certain stressors or certain triggers for the inflammatory response? What are the symptoms that you have when you get different triggers? Are they different or are they the same? And then what are the things that you may respond to over time? So we will start layering in some different things to teach your body how to have a less reactive response in the digestive system. That will most likely come through a combination of supplementation, dietary recommendations, acupuncture, probably some sort of light therapy or nerve reboot therapy to try to rebuild the relationship between your brain and your gut, which is so important. We've all heard about the gut-brain axis, and this is something that truly exists and actually affects many things in addition to your digestive health as a whole. In other words, that may have an effect on your immune system, that may have an effect on your emotional body. And so all of these things are brought into the picture when we give you that overall suggestion of which modalities we are going to recommend. That's what we want to get to the heart of. That's what we want to really dig in on. These are terrible things to have to deal with, and we want to be able to help you.